On today's Community Focus, we are now in week 2 of Rhode Island's statewide pause. But how do Rhode Islanders and Americans as a whole feel about these COVID-19 restrictions? Well, the COVID States Project did a 50-state survey, and here to tell us about their findings, Dr. Matthew Baum of Harvard University. Doctor, thank you so much for being with us today.
Thanks for having me. I appreciate it.
So first of all, can you tell us what is the COVID States Project?
So this is a survey collaboration between 4 universities, Harvard, Rutgers, Northeastern, and Northwestern universities. So we are running monthly surveys of all 50 states and producing public reports and hopefully also some academic research at some point, mostly focusing on trying to help inform the public and state emergency response and public health officials of all different aspects of the crisis as different unfolding problems emerge, what needs the most attention, where citizens are, what their attitudes are, what their behaviors are looking like, trends over time, basically trying to cover or fill in a lot of the gaps that we've had in our knowledge about what's going on around the country rather than just from 30,000 feet looking at the national level.
And there's certainly a lot of data available on your website, covidstates.org. And in a recent study, you looked at public support for some of the restrictive measures aimed at curbing the spread of the virus, things like closing businesses or schools or stay-at-home orders. So can you tell us what were your top-level findings about Americans' opinions on these in general?
So I would say the biggest takeaway from this study, and frankly this was surprising to us, was that there is pretty strong public support for a wide range of restrictive measures that are very controversial when you look at the debates in Washington. Everything from closing most businesses, limiting restaurants to takeout only, prohibiting public, K through 12 schools from teaching in-person classes. Strong majorities of the public support all of these. And if you even break it down and look across all of the states, the vast majority of people in the vast majority of states support nearly all of these measures. So we found much stronger support, much more widespread than we had anticipated. Now, of course, there are differences, so it's not that everybody is in favor of everything, but the big picture takeaway here is the public seems ready to go farther than our political leaders seem to want to take us.
And I was looking at a map that you had posted along with these findings, and it appears that Rhode Island was an outlier in New England here, specifically on the topic of stay-at-home orders. What do Rhode Islanders think about those?
So Rhode Island is actually 43rd out of 50 states in terms of being the least likely to support stay-at-home orders, but this is a glass 4/5 full or 1/5 empty, because 80% of Rhode Islanders are in support of stay-at-home orders. So it's very strong support. It just happens to be a bit lower than in other states overall.
Are there any qualities that you found in people, whether it be age, race, political views, that coincided with where they fell on how they felt about these restrictions?
Certainly. As you might expect, Republicans are much less supportive than Democrats in some respects, in particular, closing most businesses, non-essential businesses. We find women are a bit more supportive than men of most of these restrictive measures, especially canceling sports and major entertainment events, but also most of the other ones. We also find that white respondents are less supportive than all non-white respondents, all groups of non-white respondents we queried of most of these measures. The interesting exception is that we expected parents to be less supportive of keeping their kids out of in-person school than folks that didn't have school-age kids at home, and we in fact didn't find that. We found the opposite. Folks with school-age kids at home are a bit more supportive of prohibiting in-person teaching than there are folks who did not have kids in the home.
So what do you hope happens with this data?
Well, now that we've seen that the public is apparently ready for more aggressive responses to the tremendous surge that we're seeing in Rhode Island and really around the country in the pandemic, we would hope that this would give, or rather shore up, the confidence of our political leaders that they can take more proactive measures. Here in Massachusetts, we have a similar pattern where the governor has been seemingly reluctant to kind of escalate some of the restrictions because of the fear of political blowback. But what we're seeing is that it looks like the public is there if our political leaders are willing to lead them.
Dr. Matthew Baum from the COVID States Project. You can find all of that data on covidstates.org. Thank you so much for being with us today.
Thank you so much for having me.